2008. Like many of the doctors and medical students here, I knew that I could not live with working in a broken healthcare system for the rest of my career. I couldn't really stomach the idea of having to spend the next 30 years looking patients in the eye and saying, I know what medicine you need, I know what treatments you need, but you can't get it because society has decided you don't deserve it. I didn't really know what I could do about it until 3 years ago when I met Doctors for America. All of a sudden, I found myself in the company of thousands of doctors and medical students in all 50 states who are not only frustrated by the system, but we're taking a stand and we're working to ensure access to affordable, high-quality health care for all of our patients. It's been an amazing experience since then. Tonight's banquet kicks off our 2012 National Leadership Conference. Our conference theme is Physicians Leading Change. It's a theme that's woven through all the elements of the next couple of days. We will be hearing from national leaders like Dr. Zeke Emanuel, Dr. Don Berwick, Secretary of Health and Human Services Kathleen Sebelius, and many more. We will learn from experts how to use media, writing, social media, and organizing to lead change. And we will go to Capitol Hill to make sure that members of Congress hear from doctors and medical students about what we see on the front lines and why health reform is so important to us. To kick off the conference, we brought together conference attendees, speakers, and special guests to celebrate the progress we've made and the amazing work that doctors and medical students have done over the past year. We'll hear from world-renowned community organizer Marshall Gantz, and we'll share food, drinks, stories, and dancing. Our MC for the evening will be Dr. Chris Lillis, who is a board member and private practice internist in Fredericksburg, Virginia. And our DJ is Dr. Manisha Sharma, who is a family medicine physician by day and DJ by night. Tonight is a celebration of everyone who's in this room. Tonight we celebrate our co-founders who had the audacity to start this movement in the first place, Drs. Vivek Murthy, Nikhil Lovely, and Melinda Rees. Vivek and Nick, want to stand up? We celebrate the Doctors for America board for your tireless devotion to the cause. Vivek Murthy, Chris Lillis, Mona Mungat, Evan Salino, Scott Dudgeon, and Carol Liu. We celebrate our state leaders who are at every table, and those who couldn't join us tonight. Show yourselves. Stand up. We celebrate each person who is brand new to this movement, for whom this is your first experience at Doctors for America. We celebrate the dozens of people who helped in big and small ways to make this conference happen, from lending us a tripod to making this hall beautiful tonight. We celebrate spouses, family members, and guests of attendees. Without whose support, we could never juggle doctoring and advocacy. Big round of applause for that. We celebrate our impressive speakers for their generous time. Speakers who are here, stand up. We celebrate partners from the administration and organizations that share our values and whose ongoing support has helped us achieve our common goals. And of course, we're celebrating everybody who traveled here in the terrible weather to come to Washington Plaza Hotel to spend this evening with us. National Campaign Director. She's outside working. She has been working around the clock to keep hundreds and thousands of details all in her head, in her binder, and spreadsheets and everywhere to make this a wonderful experience for everyone. So clap extra loud so she can hear you. We also have a special guest here tonight who has been an extraordinary source of support for DFA since the early days. He has given us advice, come to events, and helped us figure out the best way forward for a group of doctors who want to make a difference. We are grateful for his partnership, friendship, and support. We're pleased to honor Mr. John Podesta, former Chief of Staff to President Bill Clinton and Chair of the Board of the Center for American Progress. Doctors for America, please.
So Alice has let me say a word, and I just want to say that this is a particularly important and appropriate gift tonight, because Alice knows that I'm a runner, given the fact that I was the only person who tore out Docs for America from Runner's World, which their trip to the mall actually made it into the America's Running magazine to highlight all of your good work. But I do want to be serious for a second and just say that for Vivek and Alice, for the board members, for the founders, we've been at this cause of trying to provide affordable, quality health care for every single American for a very long time. President Obama gave a big speech in December in Osawatomie, Kansas. The reason he gave it there was because it celebrated what really was one of the most important progressive speeches in the history of America, which Teddy Roosevelt gave in 1912 when he was getting ready to try to run as a progressive for president. We sometimes think that Harry Truman said we got to have health care for every American in this country, but it actually goes back 100 years to President Teddy Roosevelt in that speech when he identified the need to provide the ability to take care of people and to let them succeed and lead good lives, and that at the heart of that was providing health care for everyone. And I think one of the things that we tried to do at the Center for American Progress was to try to focus on that in 2005 and 6 and 7 and 8 going into the campaign. And there was a lot of work done and a lot of heavy lifting to be able to pass the Affordable Care Act. And obviously it's still under attack politically, it's still under attack legally. But there's a lot more work to do. This has been a 100-year struggle, and it will be a struggle for more years to provide the kind of delivery of healthcare services that the American people deserve and that you all provide. But it can't happen without the work of Docs for America, people who are committed in the medical profession to say that that's their commitment too. So I'm really, really proud of the ability to have provided a den house for Docs for America at CAP, and to have Alice as one of our colleagues in our, physically present, but also to just be a little bit associated with being able to support the kind of work that you're doing. I'm also on the board of the HJW Foundation. Matt Hollenby's here, and Hans-Jörg Weiss has been really a mainstay in terms of trying to provide financial support for Docs for America, so we'll probably help do that as well, and I want to give Matt a shout out for all the work he's done. But people have come to mistrust politics in this country, and that's probably too bad, and we'll have to work to overcome that. But I think one of the things they do trust is the advice that they get from people like you about what the future can hold. And so, as I will close with where I began, which is that if not for your voices, I think comprehensive health care would not have passed, and it will not be made. So I really applaud the dedication, the work, the ability to try to take an interest in public policy, given the pressure that all of you have in your professional lives to deal with your own patients on an individual basis. But we need you in this fight. I'm really proud of the work that you've done. The success wouldn't happen without you, and the future success won't happen without your continued participation. So thanks for all that you're doing.
Thank you, John, for your inspiration. And finally, my final thank you is to our next speaker, actually. So every movement begins with a spark and a leader. Ours began 4 years ago as an idea in one doctor's mind. He took that idea and brought together people from around the country to turn it into a movement. He has spent countless hours guiding this movement and helping us all believe that something like this could be possible. Thank you for inspiring all of us and for creating a home for doctors around the country who believe that we can build a better future together. Please join me in welcoming Dr. Vivek Murthy, President and Co-founder of Doctors for America.
It is really wonderful to be here today and to see all of you here together. This has been a struggle over the last 4 years that all of us have been engaged in to move healthcare reform forward and ultimately to work toward that vision that so many of us have of a healthcare system that works for patients and that works for healthcare providers. I was thinking a little bit about this, the remarks I would share today earlier in the morning, and there's a story that came to mind that I wanted to share with you that speaks to, at least for me personally, why so much of this began to happen. And this is a story that actually took place in the mid-1980s when I was a child growing up in Miami. So it turns out that during that time, on a particularly warm summer night, I remember being awakened in the middle of the night by my parents. And they sort of shook me awake. I was very confused when I got up. And they said, hurry, we have to go, get in the car. We all need to leave. And I didn't know where we were going or what was happening. But I sat in the car with my sister, my mother, and my father. And we all drove in the dead of night toward a trailer park in Miami. Now, I had never been to a trailer park before. And I know that my parents and my sister hadn't either. But the reason we were going was not to enjoy new vistas or new experiences. We were going because this trip was actually sparked by the death of one of my father's patients just a few hours before. Gordon, as my father's patient was known, was a dear friend to my father and a dear patient to him as well. But unfortunately, he suffered from advanced lung cancer, which led to a pretty painful end. But the reason that my parents were driving toward this trailer park in the middle of the night with all of us in tow was because they were concerned about Gordon's wife, who had just been widowed a few hours before. And they were concerned that she would be grieving alone. And so they went, they checked in on her. I remember that scene so vividly as if it was yesterday. And part of the reason that I remember it so vividly is because what my father and mother were doing were not part of their written responsibility. That was not part of being a primary care doctor per se. My mother, who managed my father's office and cared for his patients just as much in many ways as he did, also did not have that written into her job description. But the reason that they were there was because of something bigger. And what they taught me that day is something that was etched deeply into my mind. This idea that medicine was really more than just about algorithms and medications, but it was about building a therapeutic relationship between a physician and a patient, and one that was mutually therapeutic. Like so many of you, I went to medical school inspired by a vision like this, and I wanted to practice this kind of medicine. But when I entered the profession, in hoping to do what was best for patients, to restore health, and to develop relationships along the way, I found that there was a gap between this vision I had and the reality that I saw before me. Now this gap is nothing new. It's something that many of us have seen, whether we are on the provider side of the table or the patient side of the table. But it's been distressing nonetheless. You know, as many of us see patients who deserve good care, but when we can't get it to them, that doesn't feel good. But we also have seen colleagues who are cynical about the current system as they find themselves spending more time with papers and less time with patients. It's easy in this kind of environment to feel disempowered, to get cynical. And indeed, when I looked around me in 2007 and 2008, before we started Doctors for America, what I saw was a growing level of cynicism and concern and despondency among my own colleagues. But what I will tell you is that the experience of Doctors for America over the last 4 years tells us a very different story of what has to be. It tells us that when doctors and medical students actually come together to improve the health of the nation, they in fact have more power than we think they do. When we began this movement in 2008, it was begun with a very simple belief, the belief that doctors and medical students should be leaders in the charge to fix our healthcare system. People told us at that time that there were many reasons that doctors wouldn't step up to be a part of this movement. They said they were too cynical. They said they didn't have enough time. And on the list went. But in a few short years, our movement has grown from a few people in a conference room in a Boston hospital to over 15,000 practitioners in all 50 states. The history of Doctors for America is really the history of the brave people who stood up to make a difference in their communities. And these are people who overcome not just challenges at work, not just challenges at home, but also challenges inside, overcoming their own doubts and their own cynicism. But our story is really the story of those individual people, the story of physicians who came together in March of 2010 to create what became the largest march of physicians ever about healthcare reform. It's also the story around that time of 5 medical students who convinced their dean to give them a day off from classes, rented a van, and drove 12 hours all the way down to Washington, D.C. so they could stand up for reform. And it was also the story of a busy primary care doctor in Virginia who, despite having a wife and a toddler at home, still somehow finds time to go to churches, to go to hospitals, to go to community groups, to lecture people about what health reform is really about, and to discuss with them the kind of healthcare system that we want to see in our future. And I would be remiss if I didn't mention that EFA is also really about the story of people like the retired physician who came to us in early 2008, whose hands are actually crippled by age and by arthritis, but was still so passionate about the need for reform that he managed to pen blog pieces, which eventually got posted week after week, even though they were painful for him to do. While there are many people like this who have stood up, and the stories go on and on, I also want to say that Doctors for America is also about people who have toiled in silence and in sort of the quiet shadows of medicine. One story that is on my mind today is that of Ann Drum, a primary care physician in Alabama and a Doctors for America member for a few years now, who wrote to us shortly after the passage of the Affordable Care Act. And here's why she wrote. It turns out that Ann Drum practices in one of the most underserved parts of Alabama. She takes care of people who are so not just ill, but who don't have even access to the resources like medicines and other things they need to get better. And Ann has done all of this while being ill herself. She suffers from combined variable immune deficiency, CVID, which many of you are familiar with, but which has weakened her immune system to the point where she's susceptible to infections from her patients. But she's been able to survive by getting regular infusions of IVIG, which has sustained her immune system. But what was bothering Ann, and what was on her mind, was that she was about to hit her lifetime cap on coverage. And if she hit that cap, she would no longer be able to afford the IVIG payments on her own, which would mean that she would no longer be able to expose herself to patients and would have to give up her practice of medicine. Both a tragedy for her, more so even for the patients she cared for. She wrote to us shortly after the ACA passed, when a provision was included in there to remove lifetime limits on coverage. And thanks to those provisions, Anne can now see a future for herself where she can continue practicing medicine and continue caring for patients. And that's a success that all of us should be proud of. Now, it's easy to hear a story like Anne's and say, wow, that's pretty amazing. I don't have a major health problem like that. How do I compare? But the truth is that all of us are more similar to Anne than we think. Because while our circumstances may be different, we all face barriers on a day-to-day basis to providing good care to patients. They may be our own personal health problems, they may be family challenges, or they may be the many sharp ends of a broken healthcare system which continue to hurt us and patients day after day. But we don't shirk from those challenges. And I know many of the people in this room personally, and I know that many of you step up day after day to meet these challenges because this is about something bigger than us. It's about the well-being of people. It's about real lives that are at stake. And this is, at the end of the day, not about politics or ideology, but it's about people. And that's what keeps us going day after day. This banquet is an opportunity for us to celebrate that. It's an opportunity to celebrate what we do each and every day and the integrity that we bring to our work. But it's also an opportunity to remember the ideals that brought us together in this movement, the ideas that have really fueled Doctors for America. What has fueled us has actually enabled us to pass healthcare reform, to be part of a coalition that made that possible. And thanks to that, we can now say today that even though we have more work to do, more steps to take, we are much closer to that vision of a healthcare system that all of us want. We are on the path to covering 32 million more people, thanks to a healthcare reform law that we and other advocacy groups stood up and helped pass. And we're also making possible a series of small but powerful revolutions in how we deliver healthcare that's ultimately going to enable us to deliver better care to patients. But all is not well now, despite how hard we work, because even as we speak, there are threats that are mounting to turn back the hard-fought victories that we had. And we're seeing escalating efforts to repeal and to weaken parts of the healthcare law. And what has been most concerning about this is that much of this has been not necessarily about ideas, but it's been about politics and ideology. Whereas for us, what should be most concerning and most of concern is the health and well-being of people. With each day that passes, unfortunately, as the elections in November get closer, we see that these attacks and these arguments are only ramping up in time. And already, they've led to the loss of billions of dollars in the Prevention and Public Health Fund, for example, which is a fund which was a major victory in the Affordable Care Act. In state after state, we're also seeing that reform efforts are being weakened, and there are barriers that are being thrown up to actually implementing reform. Now, healthcare should actually be an issue that unifies the nation. All of us agree that the system isn't working, and all of us agree that it needs to be fixed. And most people know this in their hearts. But the problem that we face is not just that of widespread confusion about the law, but it's a failure of belief. And people have come to believe that they don't have the ability to push back on these forces and to actually create real change, to build the kind of system that we want. But I will say to you today that as physicians and as medical students, as healthcare advocates who believe in a fair and just healthcare system, that these threats to health reform stand as a clear and present call to action for us. They stand as a call to action that demands us to respond in order to create the kind of system that we ultimately want, that we ultimately entered this profession for. So that's why Doctors for America has actually launched our 1 Million campaign. You'll see signs all around you, kind of hard to escape them. But they speak to a campaign which is very important to us, and it's our effort to reach 1 million people with the truth about healthcare reform during 2012. It's also our effort to mobilize these people to demand that the implementation of health reform move forward. Our campaign was going to take place in small towns. It's going to take place in big cities. And it's going to culminate in a patient-provider march that's going to take us from the RNC convention in Tampa all the way to the DNC convention in Charlotte, North Carolina. This is a march that all of you need to be a part of. Now, you're the first to hear about this march. This was hatched fairly recently. So with your participation, with your participation, we can make this a success. Because I will tell you that a march like this has actually never happened before. People are used to hearing that industry controls the discussion on health reform. They're used to hearing that politics drives what we do. But what they aren't used to hearing is that patients and providers are actually standing up together in a show of strength to change the conversation and to change the locus of power so that it's back in our hands, so that we're making decisions about the kind of healthcare system that we should have. Now, we need you to sign up for the 1 Million campaign to commit to educating people about healthcare reform. We want everybody who signs up for this to commit to educating at least 100 people about the real impact of the law, and to recruiting at least one more person to join this team. Now, if 100 sounds like a lot to you, I refer you to the gentleman on my left, Chris Lillis, who in his spare time, when he's not a primary care doctor or a husband or a father, has educated literally thousands of people in Virginia. I think quite an impressive effort. Now, we're going to have computers outside throughout the time of the conference, tomorrow and on Tuesday, where you can sign up for the 1 Million campaign. And we're asking that each of you do that before you leave the conference. And together, our goal is to actually sign up 500 physicians and medical students to be a part of this campaign by June of 2012. Now, I will say that it is easy, in closing, to feel overwhelmed by the gravity of the challenge that lies before us. When Nick and I and a few other friends sat in that conference room in a hospital in Boston back in 2008, and we looked at the enormity of the challenge that was before us, we too felt overwhelmed at times. We were just two everyday doctors on the front lines of healthcare with no special connections, with no influence, with no money, with no experience in policy or in politics. And what were we to do? But what I will tell you is that in times like this, it is tempting to turn away. It's tempting to turn back to the things in our day-to-day lives, a sphere which we think we have more control over. But at times when I feel like doing this, I think back to a story that I heard from our Washington State Director, from Lisa Plymate, who's here with us today. And about a year ago, Lisa, who's a primary care doctor in Washington, shared a story about how she actually was part of the march in Washington that was led by Martin Luther King. When I think about that march, it has a special place in my heart, as it does in the hearts of many of us. And it stands out as an inflection point in history. But as I was thinking about Lisa's story, I thought to myself, and it struck me, that we are living in such a moment right now, a moment where the fundamental direction of our healthcare system is set to change. What's going to make a difference about whether it changes or not is really going to be us and the things that we do over these coming months. And as I was sitting hearing this from Lisa, I sat there and thought to myself, in 10 or 20 years, or in 30 years, if we are to have the privilege of being around and of reflecting on this moment, what are we going to tell our children and our family and our friends about what we were doing at this point in time? Are we going to tell them that the challenges were too great, or that this was somebody else's job and that they should have done it? Or will we tell them a different story? The story of how we, doctors and medical students and health advocates of America, came together during this inflection point in history to bring light to a troubled debate. Are we going to tell them the story of how we brought patients and private providers together in one of the most powerful partnerships ever assembled, and in a partnership that succeeded at placing the welfare of people over the concerns of politics? Are we going to tell them the story of how everyday physicians, like me and you, stood up with conviction and integrity and inspired a movement that forever changed our healthcare system? This is the story that I want to tell my family. This is the story that I believe you also want to tell your family and your friends. And right here, tonight, is where we begin by writing the first chapter of that story. Thank you all so much for being here. I am excited to have you with us for this next few days. And what I hope is that not only can we learn together about what needs to be done in healthcare reform, not only can we come to learn the skills that we need to make our voices heard, but we can build the connections that we need with each other to support each other through this journey and build partnerships that would ultimately transform healthcare in America. Thank you so much.